Hi everyone, this is Biel's quick review of the skull. This video has sutures, frontal, temporal, and occipital. So looking at the sutures first, the frontal or coronal suture is right here on the top of the head. The frontal bone is the forehead, and then the two parietals are on either side. So frontal or coronal separates those two. Running down the midline here from front to back, this is your sagittal suture, separates your two parietal bones. And then posteriorly, if I carefully pick him up, it's kind of like the bottom of the peace sign right here. This is lambdoid suture in the back. This is your occipital bone posteriorly. Squamous suture or squamosal, this is the temporal bone. So this suture right here is the squamous suture or squamosal. This would be parietal, temporal, and then right here is the sphenoid bone behind the orbit right here. Jumping quick to the frontal bone, we have to look at the glabella right between the eyes here. There is a weird looking suture line that really doesn't belong there, but the glabella is right here. The superciliary arch or supraorbital ridges are the top portion of the bony orbit here and over here. And then you have the supraorbital foramen. These are the holes here and here. If it's a hole, if it's a foramen, if it's just kind of notched out, you're going to call it supraorbital notch, not supraorbital foramen. Jumping over to the temporal bones on the side, we have the entire zygomatic arch. If it goes all the way across, this is the arch. This is the temporal bone. This is the zygomatic process of the temporal bone. Notice I'm posterior to the suture line here. If you go anterior to the suture line, this is the zygomatic bone, and right here is the temporal process of the zygomatic bone. So zygomatic process, temporal process right here. Jumping down, mandibular fossa. You can see this cup-like rubber structure that the mandibular condyle right here. It's the portion of that joint of the TMJ. It will be tagged in a skull that does not have the rubber cup in there. Posterior to that, external acoustic meatus right here, or external auditory canal, is the ear hole, folks. You can call it either or. Inferiorly, styloid process right there. It does look like a styloid. Posterior to all of this big lumpy looking thing posterior to the ear is the mastoid process. And then the last portion is a foramen. It's the jugular foramen. So if you jump inferiorly, the jugular foramen is the big foramen that goes underneath the condyle. You can't really see it here, but it goes underneath the occipital condyle. That's that tour, and look for more to pop up.